Good afternoon, everyone. The government met today to consider a number of issues relating to the public health situation. The first thing to say is that the current level 5 restrictions are having a very positive effect on the profile of the disease in the country. We are seeing the total weekly cases, 5-day average cases and the 14-day incidence rates all coming down. Close contacts, crucially, are also coming down. The sacrifices that people are making in their homes, in their families, in their businesses, and within their communities are bringing us in the right direction. And I would like to thank everyone for your efforts to date. Unfortunately, making progress on the incidence of the disease is not enough, and the rates across all age groups are still too high. We still have very high numbers of people in our hospitals and in intensive care, too high. And we have implemented the National Critical Care Surge plans, and we simply must reduce the numbers of people needing these services. Our hospitals are under enormous pressure, and we must protect the women and men of our health service who continue to heroically put themselves on the line for all of us every day and every night. It is very clear to everyone now, all across the European Union, that the emergence of the new variants of the disease represents a dangerous and new development. We cannot give the virus or its variants any space. Therefore, government has decided to extend all of the current level 5 restrictions until the 5th of March, with a view to crushing the numbers of those contracting the disease and, in turn, the numbers needing hospitalisation and intensive care. The message to people for the next 6 weeks is very simple. Stay at home. Do not travel. Do not make any journeys outside of your 5 kilometres unless you absolutely have to. Hold firm and stick to the basics. Another important issue that we've been examining is the issue of travel into our country. I understand the appeal of the idea that there's a simple answer to the pandemic in our country. We just pull up the drawbridge and we'll be back to normal in no time. However, the truth is that there is no easy way through this pandemic or out of it. The number of travellers coming into our country has absolutely collapsed, and we have taken a number of decisions today designed to further suppress that number, which we'll explain in a moment. But I first want to reinforce the key message that the most important thing we can do to drive down infections is to stay home and follow the basics around social hygiene and social distance and hand hygiene. As I said before, people should not be travelling, and the government has made a number of decisions today to further restrict travel and to mitigate the risk of new variants coming into the country. There should be no non-essential travel. Non-essential travel outside of 5 kilometres is a clear breach of the level 5 restrictions. Additional Gardaí will be deployed to our ports and airports, and those found to be in breach of this regulation will be subject to an increased fine. All visa-free short-term travel from South Africa and all of South America is suspended until at least the 5th of March. Mandatory quarantine at a designated facility will be required for passengers who arrive in breach of the pre-departure negative PCR requirement. They will also be subject to a fine of €2,500 and or 6 months imprisonment. Similarly, mandatory quarantine at designated facilities will be required for persons who arrive from Brazil and South Africa. In other cases, passengers will be required by law to quarantine at home. Application of these measures to passengers who are not European Union EEA citizens can be introduced by regulations under existing legislation. For all other passengers, it will be necessary to amend primary legislation. The detailed legislative work to implement this will get underway immediately. These regulations will apply to anyone who travels into Ireland from any port or airport on the island, including ports and airports in Northern Ireland, and policing of the regulations will be increased significantly. Restrictions on people's movement and people's freedom are exceptionally difficult. The true toll that they are taking on people's mental health and well-being is as yet unknown, but it is significant. Now, more than ever, all of us who have a leadership role across the political spectrum, in the media, everyone in society, we must stay focused on the measures that will bring this disease under control and which we as a country are in a position to deliver. The road we are on is hard. The length of time that we've had to live with restrictions and the proximity of vaccination makes it even harder. But it is the road we must take together. We have done it before and we can do it again. Taoiseach.
Thanks very much. As the Taoiseach said, we decided today at Cabinet to extend level 5 restrictions until the 5th of March. The aim is fourfold. First, to reduce daily case numbers, that's new infections, down to a very low level by the 5th of March. Second, to allow our hospitals, our ICUs and those who work in them time to recover from the surge that they're currently still experiencing. Third, to enable a phased opening of schools across February and March, starting with children with special educational needs. And fourth, to get the vaccine out to more people throughout the first quarter. We also made some significant policy changes in relation to foreign travel. With some exceptions, anyone entering the state from overseas will be subject to mandatory quarantine. In some cases, that will be mandatory quarantine in a hotel. In most cases, mandatory quarantine at home. But it will be mandatory, not advisory, for the first time. This is going to take a few weeks to operationalise. Need to be very frank about that. Legislation is required, primary and secondary. We need to identify quarantine hotels, in addition to City West, which we already have. We need to train staff, and we will need to confer and coordinate further with the European Union, United Kingdom and Northern Ireland Executive. At the moment, roughly 1,000 or 2,000 people, closer to 1,000 thankfully, every day are unfortunately contracting COVID. But very few of the people getting COVID today, yesterday and tomorrow will do so as a consequence of international travel or even encountering somebody who'd been engaged in international travel. And we need to make sure that we don't get the message wrong. The key to getting case numbers down very low again is following that basic public health advice that we all understand from day one. Stay at home if at all possible. If you do go out, wash your hands, cover your face, maintain at least 2 meters space from anyone who's not a member of your household. That will be an infinity more effective than anything we've announced today in relation to international travel or anything else. However, when it comes to March and April, when we fervently hope that cases will be very low again, that's where the issue of international travel becomes all the more important. Because if we do, as a society, succeed in getting cases very low again, we want to make sure that we do everything reasonable to stop cases coming back in again. And that's very much the journey that we begin today.
Eamon?
I think that's exactly right. People are making huge sacrifices, working really hard to play our part to help our health system get out of this. And I think they want to see, as they're restricting their travel and movements, that international travel, the same applies. And that's what we're doing. And you have to make sure in international travel it's in collaboration with our colleagues in Northern Ireland, the UK government and with the European Union and beyond. Among the decisions as we made today, as the Taoiseach said, is that we're going to make sure that the current travel regulations applicable to persons who travel to Ireland from overseas also applies in respect to passengers who route their journeys via Northern Ireland. We're going to amend the passenger location regulations to require all inbound passengers, including those going on to Northern Ireland, to provide place of residence and address on the form. We're going to conclude arrangements with Northern Ireland regarding data sharing and follow up with passengers who travel via Ireland to Northern Ireland. We're also working with the UK government. We have to wait and see what decisions they make today in regard to their own travel arrangements, but it's important we do collaborate. We do make sure that there isn't a backdoor one way or the other between one jurisdiction and the other. But more than anything else, we also need to collaborate with our European colleagues. We are keeping going with the best advice which comes from the ECDC and follow the Commission's advice in terms of having green, amber, red, and now I suppose the bigger story here today is in effect following through on that European proposal towards darker red categories where you're actually in certain instances really providing very strict restrictions, including the quarantine measures that have just been set out. So in that way, traffic numbers are going to fall significantly. Those are coming for high-risk areas as designated by the European Centre for Disease Control, have to be treated with particular care. and we manage our borders in this effective way.
Stephen? Yeah.
Thanks, Taoiseach. The COVID numbers are moving in the right direction, as we now know, but the pressure on the hospitals, and particularly on intensive care, is still high, and it's going to remain high for some time. The daily cases are now falling, and admissions have stabilised, but it is going to take some time for the numbers in hospital, and particularly the numbers in ICU, to reduce and to take pressure back off the system. And our thoughts are very much with those patients, many of whom are really very sick from COVID in the hospital system at the moment. The cases falling is in spite of the UK variant. About 2/3 of all new cases now are likely to be the UK variant, which we know is far more contagious. And it really is a tribute to the national effort to back the public health advice and back level 5 that we have been able to suppress the virus and begin to move in the right direction. It's very early days, in spite of dealing with a far more contagious variant than we have dealt with so far. And it's really essential. I know there'll be a lot of focus on the travel news and on quarantine, but it is absolutely essential that we all continue to back the level 5 measures through to the 5th of March, which was agreed today. The vaccination programme is going well. We exceeded our target for last Sunday. The target was 140,000 vaccinations delivered. For now, we will be continuing to focus on cohorts 1 and 2. That's long-term residential care and frontline healthcare workers. And this week, the target is to administer about 51,000 doses. And then we'll be moving on to cohort 3, which is the over 70s in the coming weeks. We are not happy with the news from AstraZeneca. They've announced that they intend delivering significantly less than what was agreed with Ireland and the other EU member states. The numbers have not been finalised between AstraZeneca and the EU. We're working very closely with our EU partners with the aim of maximising the volume of delivery as close to the agreed schedule as possible, and with having the delivery arrive here as soon after authorisation as possible. And I just want to end by thanking all of the healthcare workers. It's been an incredibly difficult year for all of those working in healthcare, and they've stepped up all year, and in the January surge they have stepped up yet again in the most difficult of circumstances because of their work, and because of their dedication, and because of their skill. Many Irish patients, the patients who are having to go into hospital, are receiving the best possible treatment, and I just want to acknowledge that and acknowledge their ongoing work. Thanks, Taoiseach.
Taoiseach and Minister for Transport, just in relation to the travel restrictions, you say that it's going to take a couple of weeks to operationalise. Can you give a date for that, if at all possible? And how are Gardaí going to actually implement criminal sanctions against people who are self-isolating at home? Will they have powers to call to their homes, for example, or will they be following up with people by doing spot checks or whatever? Have any of the details of that been worked out as yet? And just in relation to the agreement with Northern Ireland, how are passengers who are arriving into Belfast or into Larne and then coming down to the Republic, how are they going to be susceptible to sanction? I mean, will there be a database that's provided by the North that will allow the authorities down here to know who's come in and the address that they've given? And will that have implications, for example, for their civil liberties? And the very last thing you talked about, these restrictions being in place for when numbers begin to drop. How long will these travel restrictions be in place? Are we talking about until the end of the year? Or are we talking about sooner than that?
Well, first of all, I would say that a very important point to make in relation to travel is that from the evidence so far, and a bit more work is required here, but the majority of people travelling and coming back into the country are Irish citizens. Quite a number went on holidays during the Christmas period and are coming back. And I think that's why a lot of the emphasis is on actually what we can do domestically to reduce travel by Irish citizens, non-essential travel by Irish citizens overseas. That's a very important aspect of this, and that's why the extra guarded checkpoints at airports and airports will have an impact, and that's why other measures we have taken. Some measures can take place immediately in terms of the suspension of short-term visa-free travel, for example, can take place very, very quickly. some of the regulatory and some of the measures we've outlined in respect of Brazil, and that from a regulatory perspective can take place quickly because the existing legislation covers that. Obviously, there are operational issues around the securing of a facility and the organisation around that, but we're going to try and do that as quickly as we possibly can. We're not putting timeframes on it right now, but it will be shortly. This has been addressed in an urgent manner, and the primary legislation that I referenced earlier to deal with all EU citizens and so on will be formulated very quickly as well, and we look forward to the cooperation of the opposition in terms of passing that legislation in the House as quickly as we have it ready. So we think the regulatory framework required for quite a lot of this will be ready by the end of the week, but other parts of it will take a bit more time, particularly the primary legislation. In terms of your timelines, generally, just would point out that some of the modelling we received last evening from NEFIT, which was interesting, and remember, the numbers will come down and are coming down, but the real pressure point is hospitalisation and intensive care. And even at the end of February, with the best outcome, if you like, or potentially best outcome scenario, you're still looking at between 800 and 1,300 in hospital and potentially 100 in intensive care. And that is why we must keep the pressure up on the virus and do everything we possibly can to reduce it. And hence, that's the kind of metric that we will be consistently looking at over the next while, over and above cases and everything else, because as the Taoiseach just said earlier, the hospital personnel, we need to relieve the pressure on them, and the system will need time and space from the current very strong pressure on them. In terms of Northern Ireland, our officials on both officials representing the executive and officials representing my department and other departments here have been meeting quite constructively. And the idea of data sharing is on the agenda, certainly from our perspective, to share data as Eamon outlined, coming in for personnel coming in from Dublin Airport en route to Northern Ireland. And we would be looking for a sort of a reciprocal arrangement in terms of Northern Ireland onto the Republic. But these are issues that are currently still under negotiation, but today's decisions facilitate that and confirm that. But it has been a challenge. You have two political jurisdictions. You have the executive and you have a government in the Republic, and there are political sensitivities around it. We all know that, and there's, those are the realities politically of that situation. But we will continue to work together. And in the context of the United Kingdom, there has been talk, albeit at an early stage, in terms of a two-island strategy, and I know that the Minister for Foreign Affairs and the Secretary of State have had some preliminary discussions on that. I've had a preliminary discussion with the Prime Minister in relation to it, but a fair degree of fleshing out of that would have to take place.
And just if I can on that, on that Northern Ireland, that passenger locator form will give us the details of who come in. Most people coming from the UK will have similar requirements in terms, they also now have a requirement for PCR coming in, but it gives us that capability to follow up.
Taoiseach, just as a brief follow-on to some of the comments you just made there, if in the best case scenario at the end of February, if there could still be at least 800 and potentially 1,300 people in hospitals and also still 100 in intensive care, does that mean that there are no guarantees at all that March the 5th will be the end of this present lockdown? And on a wider note, you've said before that we obviously can't embrace a herd immunity strategy because of what it would mean in the meantime. You've also said that you didn't believe it would be feasible at all to eradicate it, and therefore by default we have to live alongside the virus. But if we are now in a world where a faster spreading variant is the dominant strain in Ireland and the virus will bounce back quicker at whatever point we relax our restrictions, is there not maybe time to go back to the drawing board and wonder whether in fact an eradication might be a better strategy?
Well, just a number of points on that. First of all, you're correct in saying there are no guarantees. We might do better than those scenarios if people stick with it. I instance that just to say to people, the motivation for these measures is very, very clear. We've got to get these hospitalisation numbers down. We've got to reduce community transmission and ICU numbers. We will review it again at the end on the 5th of March. There are no guarantees about anything. But remember, parallel with this now for the first time, parallel with these restrictions is the rollout of the vaccination programme. And that is a very key game changer compared to last year, for example. And the more and more we vaccinate, and the more vulnerable groups we vaccinate, the more elderly people we vaccinate, both in residential and in community, and frontline healthcare workers, we do give ourselves a bit more choices as we move along the year. And we expect, notwithstanding the difficulties with AstraZeneca, and there are challenging negotiations going on and discussions between the Commission and AstraZeneca, the Pfizer-BioNTech volumes will increase in Q2, for example. Overall, in Q2, we will have significantly more vaccines to administer than we had in Q1. And so that parallel vaccination rollout does give us more room for manoeuvre than we otherwise would have had last year. And I've been clear, as I was earlier this week or last week, that we are going to adopt a conservative, cautious approach now, because we have the weapon of the vaccines on the one hand. It makes sense that we approach this cautiously and conservatively. On zero COVID, we discussed that last evening as well with NEFIT, there could be further discussion, but the sense is we've never been advised to go into zero COVID, and I don't think it's possible or sustainable in terms of a zero COVID strategy, because, as put to us last evening, it's a promise that you could never fulfill. In terms of once you reopen again, the prospect is there for reseeding of the virus, and that is given our geographic location. And given the seamless interaction north and south, for example, which sometimes people put forward the idea we can seal the border. One cannot seal the border. The movement around the border, the communities are in and out of each other's community. Anyone who lives along the border will tell you this. It's not as simple as putting a kind of a seal on the border between Northern Ireland and the Republic. It's seamless interaction. Likewise with the UK. We have very severe restrictions now, but there's always been historically that interaction, and then we're connected to the European Economic Zone. So there's always a limit to the degree to which you could seal the island of Ireland. There are real limits on the capacity to do that. That said, a very strong policy of suppression of the virus, in my view, can be effective, particularly parallel with a vaccination rollout.
Thank you. Just a couple of questions. Minister Ryan, just a scenario for you, because I know what you were saying about enforcement of ports and airports, and that people can be fined if they're stopped for non-essential reasons. If someone is going to Dublin Airport intending on getting a flight to the Canaries or wherever, can the Gardaí turn them around as well as fine them and tell them, go home, you can't go on your holidays? Or what's the restrictions there? Taoiseach, you mentioned in relation to schools kind of phased over February and March. Do you think there's any realistic chance of full school opening in February, or is it going to be special education at best case scenario? And Taoiseach, just to pick up on your point there with Gavin, so accepting what you've said about zero COVID maybe not being implementable, we are going to reach a point, be it at the start of April, end of March, wherever it is, where the cases are very, very low, but not everyone will have been vaccinated. So what's the plan? Are we going to do another open up and hope we don't have to lock down, or what do we do then?
Okay. Eamon?
The Gardaí, the application they're applying is to fine. I think 1,500 fines, if I'm correct, so far since the new fines have been introduced. There is provisions if someone goes down from the north that they can ask someone to turn back, and we're looking to actually strengthen that so that we actually have the same fining capability in terms of traffic coming from whatever different direction. But I believe that fine, on top of the PCR requirement, on top of the other regulations we're putting in today, will achieve the objective. The objective here is to reduce the volume of traffic. Even though it was already down 90% because of the circumstances, because of the concern about variant, because we want to back up what we're doing here, it is reducing the overall volume of traffic is going to be key. And that it's those series of different measures put together is what works, or what will work.
Yep.
Just on education, and Minister Foley and Minister Madigan are working very hard on this and very closely on this. At the moment, the number of cases is falling by about 7 or 8% a day. It's halving roughly every 10 days. So if we're in around 1,000 now, it's reasonable to project that in 10 days' time, if we all keep doing what we're doing, we could be down to around 500 or 600 cases a day, and maybe in 20 days' time, half that again. That's optimistic, but it is our current trajectory. So if we keep doing those things, then we'll have case numbers down to a level much lower than they were when schools were open. And I think that does allow the prospect for a safe reopening of schools on a phased basis. across February and March, starting with children with special needs, but then potentially moving on to other groups too. The reason why we would prefer to do it on a phased basis is because of the more transmissible B117 variant, not wanting to take that risk of 1 million children moving all on the one day. But this is something that we're very keen to agree with everyone involved in education, not just teachers' unions, but also parents' groups, students' groups, and the management bodies as well. And that work is very much underway, led by Minister Foley. Finally, I think Gavin asked a very fair question on eradication or elimination. There's one thing that I'm absolutely certain of is this virus keeps surprising us, and this virus keeps tearing up all our plans. And we always have to have an open mind to different strategies and different policies and different ideas. And certainly the idea of a two-island strategy makes a lot of sense to me if that can be achieved. But one thing that I think is that there is a real difficulty with an elimination strategy for Ireland. Even if it were possible, taking into account the border and our geography, the probability is that this virus is now endemic across the world and will always be present somewhere in the world. So whenever you open up, unless you're willing to cut your country off forever, whenever you open up, it will come back in. So what the vaccine offers us is the prospect of this being a virus that we can live with if the vaccines work effectively enough, that it becomes a virus more similar to what we experience, like, for example, influenza, one that unfortunately affects us, but doesn't overwhelm our hospitals and doesn't cause us to have to shut down the country in the way we did. But that's contingent on the vaccines being provided to 70–80% of the population, or whatever is required to achieve herd immunity, and is contingent on those vaccines being effective against any new variants that may arise. And we just can't know that now, so we have to be nimble in our response.
Yeah, just in terms of your question, in terms of what's the plan in terms of April, again, it will be the vaccination issue will be key to determining the nature of what will happen in that quarter and the nature of the reopening. Now, the reopening, as I said, eventually when we get there, will be cautious and conservative, because remember, it's the impact on the hospitalisation and the ICU. So even if we get case numbers down, any lapse in between with variants and so on could start putting the hospitals under pressure fairly quickly. So we've got to really watch that and protect our frontline healthcare workers and people more generally. But quarter two was always meant to be the movement from a limited vaccination programme, as in quarter one, which we knew all along would be limited because of volume, and the issue was delivery. Q2 was more about mass vaccination and administration of the vaccine. Notwithstanding the difficulties with AstraZeneca, we're going to have more significant administration of the vaccine in Q2, and April, May and June were always meant to be significant months in that respect. And we're hoping that Johnson & Johnson will come on stream as well in March. So that will shape the nature of the reopening of society and the decisions we take then. In the interim, I think the most effective thing we can do is get the numbers down really low, and hence the need for the extension of the current level 5 restrictions to the 5th of March. In relation to education, we're giving the Minister for Education, the Department of Education, the space to work with the partners in education, initially on special needs education, with Minister Foley and Minister Madigan, to work in consort with the partners to make provision for children with special needs. Obviously, the Leaving Cert cohort has to be addressed. We're going to give a bit of time to work that out and the details of that. So space will be provided to the department, to the Minister and the partners in education to work those issues out. And then in terms of a phased reopening. As we said, the reason not to reopen the schools in the first instance was the idea of 1 million people mobilised at the one time and the impact that could have on the transmission of the virus, particularly with the UK variant becoming so dominant in the country.
A few questions for Minister Donnelly. Minister, first of all, I thank you for being here. I think this is the first time you've taken questions at a press conference since the budget, so hopefully it won't be the last time we see you. On the vaccine rollout, you mentioned the extraordinary work being done by healthcare workers in the front line, but what do you have to say to workers in ICU who had their vaccinations cancelled because of your decision to accelerate the rollout in nursing homes?
Thanks, Craig. I've heard you say this before, and I've seen you write it. It's not true. There was no diversion of vaccines whatsoever. What there was a schedule for healthcare workers. What I asked for was an acceleration for nursing homes. That happened, and what it did was it compressed 3 weeks of vaccinations into 2 weeks. I asked that it didn't affect the rollout to the healthcare workers. I was given an assurance it didn't, and what it did, how we did it, was we depleted the buffer. So we were holding about 1 week in the buffer, which is about 40,000 doses, and we depleted that to be able to accelerate to the nursing homes.
You're saying that's untrue. Well, we published documentary evidence which showed, in one example, staff in Our Lady of Lourdes Hospital got a note, internal note, your vaccinations are cancelled because all available stock is being redirected to the nursing homes. Now, people don't have an issue with the nursing homes being vaccinated, but I think it's fair to say that if hospitals knew that their supply was going to be shut off at 24 hours' notice, that they would have ensured that the healthcare workers in the top order of the sequencing would have been prioritised instead of the more free way it was given out before that. Do you not accept that?
I think there's a few issues. I think the first allegation was there some political interference in diverting vaccines? So the first allegation is that there was some political interference in the diversion of vaccines. Absolutely not true. The only thing that I asked was that the rollout to the nursing homes was accelerated. It was accelerated, and the HSE deserve huge credit for that. And as I said, we did that by depleting the buffer, not by diverting. Now, if there were individual operational decisions made by individual hospital groups as to the allocations within their hospital groups, they're operational decisions that the HSE has made, that each hospital group has made. Their focus has been on vaccinating the first two groups. There was a further protocol given for the subgroups within the healthcare workers, and that's what the HSE has been working to do. I think the healthcare workers are very understandably seeking the vaccinations, but the reality is that by end of day Sunday, we set a target for 140,000. That was split broadly 50-50 between long-term residential care and frontline healthcare workers. That target was met, notwithstanding some of the nursing homes, because of COVID outbreaks, couldn't be done straight away. So I think, Craig, the HSE deserve great credit for rolling out a vaccination programme. It was one of the fastest rollouts in the first few weeks in the EU. Naturally enough, we've about 150,000 frontline healthcare workers. In the initial few weeks, there was an allocation of half of the doses split between cohorts 1 and 2. So there are still frontline healthcare workers who are looking for the vaccine, and we're looking to get it to them as quickly as possible.
You said you got reassurances. You said you got reassurances on the supply. Sources in Pfizer said that they gave no new guarantee, and a week later, we had the emergence of a major supply issue with Pfizer. I mean, so when you said that you had reassurances on supply, I mean, where did they come from? Did they exist at all? You know, if suddenly a week later we had this massive shutdown.
I'm sorry, what's the question, Craig?
I'm saying, did you actually have reassurances or not?
Yeah, I've already told you we had reassurances. So what we did was we depleted the buffer. We were holding about 40,000 in the buffer. We brought that right down, and we brought forward 26,000 vaccinations, which were meant for the third week for the long-term residential care, into the first 2 weeks. That's how we did it. And yes, the assurances were provided.
Just as a general point, the view always was that the impact of the Pfizer-BioNTech vaccine is most effective on senior citizens because it reduces mortality and it reduces illness. And those two cohorts, frontline healthcare workers and nursing home residents, were always the priority. Pfizer would have given guarantees to the National Task Force in respect of ongoing deliveries. At the European level, we all saw that debate unfold where they want to expand their capacity in Belgium so as to increase overall volumes for the next period. They were going to initially do it for 3 weeks, which really would have interrupted the supply. They managed, through discussions and the pressure from the Commission, got that down to a week's interruption of supply. They're adamant that they will meet their Q1 delivery contractual targets with the EU, and that includes us, for the Q1 piece, but that they will be able to increase then the volumes for quarter 2. I think the simple reality is we just haven't had enough vaccine in Q1 because there's only one real manufacturer has come into play in Q1, that's Pfizer, BioNTech, Moderna laterally, but Moderna's volumes are quite low. So that's the context. And really, I think the priority from NIAC, which is the National Immunisation Advisory Committee, has been to try and reduce mortality and severe illness among our senior citizens, and that's kind of the prioritisation that generally is being followed. Sorry.
Má thugn cho fada sin na sríanta chu bhaim, má tan tú cainte reachtaíocht tan tú cainte beidir deir mí fiabhras ar a bheith siad a bhaim. Agus an son, tá sé beag nach blian, be sé bliana mí máta ó tháinig na sríanta seo isteach ag a hús. An fé letarrála dtíine buile faoi thuirmthairt do dhaoine maiall ar caitheann a bheith siad an an file ar an gnáthhéal mar a bhí.
Well, gan áras breithin sé sin ar na vaccíní agus cé có topic is féidirling na vaccíní a thuirt do dhaoine ar fud na tíre. Tá mí déanamh tá dul cin le feiscint, díag ar níag, ag níos mó le feiscint mí a brán, mí bealtain agus mar sinnde. Agus sin rud a bháin ó thaobh an reachtaíochta cuidas na nithe atá a bhí fí chabad le going anmh be mí den án é sin a thuirteach beag nach láithreach ó thaobh na vísas agus mar sinnde, agus ó thaobh an reachtaíochta tá ann fí láthir is féidirling reintas na nithe seo a chuir a bhaim cuisigh tapig. An reachtaíocht beag sé sin ag bint le daoine ón Europe, ach daoine las mud in Europe be mí den án na cinenne tá déanta goine chuir a gríoch agus chuir a bhhaim. Ó thaobh an vírus corónach mar a dúirt an tánaiste níos luithe, tá sé gathú a gcónaí, agus tá dacrochtaí ag buint lei sin, agus tá dúláán an a bhór amach roing dá dheasca san. So ní féidir le aine dáta a fiocha in mé tú an rá go bhfuil deire leis an vírus seo. I má thurmse ní bheith géon lán, ní bheith lá bháin an is féidirling ará, ach díag ar níag be mid ag dul ag míne ag dul níos láidre os rud go méid níos mó vaccíní ann agus sin an tlí ina méid mórthmse rudí ag dul as seo amach. Tá ag súil i lá i rith an táraigh, lá an táraigh go méid an scéal níos fearr ná mar atá sé inis mar tá na vaccíní ag teacht.
Just one for Taoiseach. Taoiseach, businesses crave certainty and they have to plan. So in relation to the hospitality sector, can I just ask, I think it's safe to say that the St. Patrick's weekend is gone for the hospitality sector, but Easter is following fairly quickly after that on April 4th. And can I just ask that a runner? And then perhaps if you could give any hope to the sector looking at maybe the May Bank holiday weekend or the June Bank holiday weekend, which would be the 7th of June, that Monday. Is there any hope we could have any bars or restaurants open at that stage? And just a second question perhaps on fines. We've heard that you discussed that the €100 travel fine will be increased, but it hasn't been decided yet. But could you give us a range, perhaps, what people could be fined for breaking the 5k limit?
Yeah, well, at the moment it's a €100 fine for breaking the 5k limit, but it's the same fine for running a kilometre or two further away from your house than you should, as it is for a ski holiday. And that seems a bit disproportionate that somebody who, may go a few kilometres further from their house than they should gets the same fine as somebody who really breaks all the rules by going on a sun holiday or a ski holiday at this time of year. So it's going to be something, we haven't agreed a figure, but somewhere upwards of 500 anyway.
Somewhere to €500.
Then just on hospitality, look, I know businesses want certainty. It's not just businesses that want certainty and clarity. Ever since the pandemic started, people have sought certainty and clarity, and it's the one thing we haven't been able to give people because the situation is so unpredictable. But I am an optimist, and I do think that come the second quarter of the year, come April, May, with the better weather, with case numbers down low, with the vaccine provided to a critical mass of the population, we're going to be in a very different place. And I'm more optimistic about where we're going to be this summer than maybe I should be, but it's impossible to put a date on any particular reopening at this stage. But what I can say to the hospitality sector is that the financial supports that are in place will stay in place. The weekly grant for businesses that are closed, the employment wage subsidy scheme, the commercial rates holiday, and I'm working with my officials in particular now to examine a group of companies that don't receive the CRIS, companies that have a premises, but because their premises is not technically closed to the public, they don't qualify, but still their turnover is very far down, and we hope to do something for them as well.
You're optimistic for summer openings. Would you be optimistic for the start of the summer, which could be May?
Not going to go there. Nice try.
You're fairly thirsty, fairly.
Just on quarantine, with hotel quarantines, how soon do you think you'll be able to get those up and running, Taoiseach? And also for those who will be availing of this, who pays for it? The people staying there, or will the state pay for it? And then perhaps Taoiseach, maybe for mandatory quarantine at home. So let's say somebody arrives into the airport, would they be allowed to get on a public bus, a taxi? Like, how will that be policed? If you could maybe just give us more information on that. Thank you.
Yeah, on the hotel quarantine, we have the capacity already to quarantine people in City West, which is broken into red, green, amber zones. And we think the numbers obviously initially will be quite small. The huge effect of this is going to be a deterrent effect. The people won't arrive anyway. Work will be done led by the Department of Health to find most likely hotels close to the airport, Dublin Airport, which would be the logical place for a quarantine centre. It is intended that people will be charged. So again, the details have to be worked out, but that's part of the deterrent.
Yeah, decisions that people will bear the brunt of the cost of the quarantine facility, and in terms of the home-based quarantine, that's putting current advice, which currently happens at the moment. That is the advice in terms of people who come in from any situation abroad. But essentially, the details of that will be worked out. But we're making that current advice mandatory, statutory. We're putting on it a statutory provision. And clearly, in terms of public health advice, will apply to that as well in terms of how the person gets home. But we'll have to adhere to public health restrictions, and obviously not to in any way be responsible for the spreading of the virus. But essentially, it's to put on a statutory basis what is the current advice for some people coming into the country.
Sorry, just to go back to that issue of travel, Minister Ryan, you did mention there the traffic light colour-coded system. Am I right to say that we're still operating under that? So you're saying basically that all travellers coming in are advised to self-isolate or restrict their movement. So obviously at the moment, majority of countries are red. So that means that if you come in, you have to have a PCR negative test, and you should be getting one 5 days later. Does that mean that the legal quarantine issue is for those 5 days, or does it go on to 14 days? Just a bit of clarity for that. And obviously the numbers are going to go down, hopefully, both here and in the rest of Europe, which could bring us into us being a green country or an amber country, which means that we're not required to self-isolate when we get off a plane. So is that still going to be in place under these current rules?
It is important that we stick with our European colleagues, because this is going to be operating for some time, and therefore how you designate and how you make this effective is when you do it collectively, not just with the UK but also with the rest of Europe. But there is at this particular moment in time real problem, particularly with concern about variants, and because our system is on such a precarious system. So these, what you might call darker red countries, the likes of Brazil, South Africa, were saying that no, it has to be full 14 days, that option out, or that 5-day release, no, won't apply. We're going to go with the strictest possible measures, and continue to review them with the ECDC, the European Centre for Disease Control, and also listen to what the European Commission has to say there, to come back later on this week with further advice and further iterations, I think it's right for us to work in that collaborative way.
On particularly, you're saying, there's headlines there saying that most people that arrive into country will be subject to quarantine either in a hotel or at home. But we're operating under a current system which is up on the Department of Foreign Affairs website, which has different colour codes depending on what country you come in, and it has different obligations. So I think people will want to know exactly when.
Sorry, again, just on that, so I should explain that in more detail as well. Because the current particular stressful situation we're in, we're saying all visitors would have to actually apply where they do isolate, where they do restrict their movements. They can, if they're in whatever category, red, amber and orange, avail of that PCR test to free themselves from that. But the critical one, I suppose the critical change is that those countries, Brazil, South Africa, those freedoms don't apply, or those ability that they have to stay in self-isolation for 14 days.
Sorry, the legal quarantine issue then is for the 5 days, and they can still get that second PCR test and be free to go. Is that correct?
From the home quarantine, but not if they're coming from Brazil or South Africa. Or if they don't have a PCR test.
And just to add that the situation in the EU is a bit more dynamic now because of the context of the variant, and there's been greater flexibility allowed to member states, and there's further discussions to be had at the European Union level following last Thursday's meeting, where there's a lot of concern about the variant.
A lot of grim news of late, be it from vaccines or, the restrictions and more. Is there any good news that you can give for perhaps the summertime in terms of, okay, hospitality is one thing, but a lot of people will have, be eager to see family and friends. Is there any hope that you can give that either in March, April, that those household restrictions, those outdoor restrictions might be something that would be looked at first to be changed?
The first point is that we're reviewing these regulations and these restrictions on broadly a monthly basis. So on the 5th of March we will review these. But we have to really hammer home the message. Now is not the time for, the time right now is to double down, get these numbers down, get hospitalisation numbers down, and get the pressure on intensive care down. That's my horizon right now. I can think of future horizons after that. But for now, get hospitalisation numbers down. We have to. It's not that the pressure the hospitals are under is not sustainable, particularly for the staff. They've been on this now for 10 months or, since this pandemic started. They're under a lot of pressure. We've got to relieve that pressure. And the same for intensive care. As I said, one modelling yesterday was the presentation that even with everything going right for us, we could still be somewhere between 800 and 1,300 at the end of February in terms of people in hospitalisation and up to 100 in ICU. Remember, outside of ICU, quite a significant number of patients who are being assisted, who are availing of respiratory assistance. Some of those will go into ICU. So it's that hospital environment that we're focused on to take the pressure off by reducing community transmission in the number of cases. So then that will inform what we do at the end of this particular phase on the 5th of March, because we don't want to in any way increase the pressures on our hospitals, particularly when there's a vaccination program being rolled out. And certainly by then, we would hope to have nearly all our frontline healthcare workers vaccinated as well. And that's an important consideration. So take it one phase at a time.
Taoiseach, last night on Claire Byrne, you said that mandatory hotel quarantine wasn't really an option because it might take away people's ability to see family at Christmas or to travel in the summer, maybe in August. Does it stand to reason then that you believe that people will be able to travel abroad in August and will be able to travel to see their families at Christmas? And Minister Donnelly, your goal was on Sunday to have every resident and a member of staff at a nursing home vaccinated. Was that goal achieved? And if not, how many people are still waiting for their vaccinations in those facilities? We've asked your department, but they haven't come back to us with an exact figure. So where are we at on that today?
Just in relation to mandatory hotel quarantine for all arrivals, I didn't say it wasn't an option. I said I wasn't ruling it out. So that's quite a different thing. But I did point out some of the realities of it in an Irish context. One, that it wouldn't be fully effective because of the border. And we can't impose 14-day mandatory hotel quarantine on a land border. And also, I said we had to be realistic with people, that if we were to go down that route, it would be most likely for a year or more. And New Zealand only announced in the last few hours that they intended to keep their borders closed for 2021. So they aren't going to reopen to foreign travel in any meaningful way until sometime in 2022. Now, they're well behind us on the vaccine, but it does kind of speak to what I said yesterday, that if we were to go down that route, you wouldn't really be able to safely say that you're going to reopen your country until even beyond everyone's vaccinated, because we'd have to know that the vaccinations confer herd immunity. We'd have to probably get through another winter, another Christmas. Maybe it'll come to that anyway. Maybe it will be the case that international travel is not possible this summer and not possible this Christmas. But I don't think I certainly don't want to close off that possibility today. But maybe we'll have to.
Yeah, Paul, the plan was to hit 140,000 by end of day Sunday, so we'd up-to-date figures for there. We'll have up-to-date figures again on Thursday for end of day tomorrow. Broadly, the 143,000 was approximately 65,000 long-term residential care and about 78,000 frontline healthcare workers. The vast majority in terms of nursing homes, both staff and residents, and then the over 65 residents in long-term mental health and disability were got to. Unfortunately, we can't vaccinate people who are currently infected with COVID, and as we're all aware, unfortunately, there are quite a lot of outbreaks across the nursing homes. So what that means is that for some of the first doses, it was possible to do the other residents and the other staff, but then we'll come back again to do the first dose. So this week, for example, the plan in long-term residential care is to do to get 2,600 people their second dose, so 28 days after the first dose, and just a little under 4,000 for their first dose for this week. So broadly the target was hit, but with the caveat obviously that those who were infected, we have to wait till they're clear and then we go back and vaccinate them.
Would that 4,000 finish it off for the people who are currently infected?
Yeah, by those who are currently infected.
Do you have a number for those who are currently infected?
I don't, but I'm sure we can get something, yeah.
Sorry, did Professor Mills not say that those who were currently infected don't actually require vaccination? He made that point in an op-ed article a couple of weeks ago. I think the government was going to have a look at that and explore it. Certainly your department, I think, was going to have a look at that.
Yeah, so Professor Mills wrote a piece looking at NHS data, which was showing that the reinfection rates for healthcare workers who'd been infected were very, very low, and he was posing the question, in a world of very scarce supply, could we therefore not vaccinate those who'd already been infected? I discussed it with the Chief Medical Officer. NEFIT are considering it. One of the concerns with it is that the level of protection you have could be a function of the severity of the level of protection could be a function of the level of severity and the antibody response. So they're going to look at it, but it's certainly not something that is a policy decision at the moment.
Okay.
Taoiseach, on the mandatory quarantine at home, when it comes to policing, is it envisaged that Gardaí will be calling to people's homes to check that they're complying with the quarantine? And then secondly, I know no one predicted the cases and hospitalisations going this high, but on the opposite side of that, if the cases drop quicker than expected, could the situation on lifting restrictions be eased quicker than March 5th, or is that locked in now?
In my view, it's locked in to the 5th of March because the case numbers will drop, okay? But COVID has a long tail in terms of the hospitalisation and intensive care. In other words, people are in hospital for prolonged periods and they're in intensive care for very prolonged periods. So it's that hospital figure at the end of February. If we do better on that, that might give us some room at the 5th of March to see how we deal with things. But essentially, we're really knuckling down now and saying to the 5th of March we're going to continue the restrictions as they are. And that will continue because of the issue around the high numbers of patients in hospital and intensive care. And in terms of the mandatory home situation, the Gardaí will be others. The Gardaí essentially will be able to police that. There will be challenges around that, but essentially it will be law. And my experience, generally speaking, when we've made something law, the compliance has gone significantly up. When a lot of people do not want to commit a criminal offence. I remember the debate around masks before their introduction on public transport. There was, who will, I was listening to the programmes, who will implement it? Will it be the bus drivers? Will it be the Gardaí? The same in shops. Once we introduced it, the public enforced it and made sure it happened. But we will be looking at the detail of all of that as we come to it. Sorry,
Sorry, can I just very quickly ask the Taoiseach, just on your point there on hotel quarantine that's mandatory, you said that if it was brought in, it would be at least a year. Why is it a year, not maybe a couple of months that it could be brought in for? And Taoiseach, can I just ask on zero COVID, it seems your colleagues in some opposition parties are out again calling for a zero COVID strategy. It seems like there hasn't actually been any consideration given by the government, any serious consideration given by the government to zero COVID strategy. It's just been sort of dismissed. So I suppose it looks like we are in this sort of lockdown surge, rolling endless lockdowns. Surely you would give serious consideration to the zero COVID strategy at this point.
To answer your question, if you're serious about elimination and you're serious about COVID being zero, surely it would go on for a couple of years, or maybe indefinitely, because COVID is now all around the world. It's always going to be active in some part of the world. So whenever you reopen your country, you then don't have zero COVID anymore. It then re-enters. So that is one of the problems with a zero COVID strategy or an elimination strategy is you have to, if it's possible, it's not possible for us, but if you can seal your country off entirely, when do you ever unseal? Because then inevitably you let the virus back in again, and you expose a naive population to the virus at that point. And that's why in New Zealand they've said that they don't even intend to consider reopening to foreign travel until they vaccinated their population. They haven't even started vaccinating their population yet. So one thing that does concern me about this debate sometimes is people always want the one thing we could do that would solve it in a few months. And I think that's part of what I know both NEFIT and government find a little bit frustrating about the zero COVID promise. If only you did this one thing, in 3 months we'll all be living like New Zealand. Like that's a false promise. It really is.
Just to add to that, I think we don't control all the levers to give effect to a zero COVID, and particularly we have the issue with the border. I think our geography does matter in that context, and I think as the Taoiseach has said, it would have to be a very long-term policy, and there is a question about its sustainability in the context of Ireland and where it's positioned. That said, it hasn't been dismissed. I mean, it has been subject matter of public debate for quite some time between experts for and again. NEFIT have never advised government to go zero COVID. And the NEFIT position is that we suppress the virus to the lowest possible level. And we learn all of the time, and we evaluate strategies all of the time. I think there will be issues around when we suppress this current wave. And I think the people have responded magnificently to the restrictions and are adhering to it. Pressures will come on that, as we've seen in earlier phases. I always, in different parts of the world have different cultures and different approaches, but the whole area of governments on a prolonged basis restricting movement has its own challenges as well. But the zero COVID, like we discussed it last evening again, it's never been advised actually that it's a sustainable policy to the government. Well, what we're going to do is, first of all, be very conservative and cautious now. What we're doing today, we're extending the restrictions to the 5th of March, quite a significant decision. The vaccines are being rolled out parallel to that. That's the big change here. And I think that will, in my view, suggest a more conservative approach, certainly to the middle of the year. We look at this on the 5th of March to see what may be necessary to do in some areas. But by and large, with the vaccines being rolled out, it makes sense to be cautious because we can protect people now from this virus with the vaccines. And that's the big challenge now at the European level, is to make sure we can get the delivery of the vaccines in sufficient volumes because a lot of work has been, detailed planning has been done in relation to Q2 and Q3 vaccination programs. The only disruptor of that will be the issue of the companies being in a position to deliver the volumes that they've contracted with the European Commission to deliver.
That Gardaí will now be based just short of 5 kilometres from the border to ensure compliance from Northern Ireland residents. Will that be the case? And if so, are the regulations therefore going to be amended? Because right now they only apply to residents of the state rather than anyone who happens to be within its borders.
That hasn't been decided on today, but that issue will be examined further, but it hasn't been decided.
The border issue and policing at the border hasn't been decided.
That issue that you've raised, that specific issue in terms of having specific penalties from people from outside, from the north coming into the Republic, hasn't been decided on. There'll be more work needed on that.
Okay.
Yeah.
That was going to be.
Sorry,
Mr. Ryan earlier,
that's
I thought, referred to it as
no,
something.
The decision hasn't been taken today in relation to it. It'll be examined.
We sought the Attorney General is to come back with a legal mechanism where it could be achieved.
Okay. Is that because it applies to citizens residents, people outside the state?
Yeah, there's a number of factors. As I said earlier, the interaction between North and South. I mean, if you live in Donegal or if you live in Dundalk, people are moving to and fro for work purposes, for a whole range of purposes. So we just have to make sure that it's right by the time we consider its implementation.
Sorry to ask one more final question just to follow on to Gavin's point a moment ago. If we were to potentially seal borders or to pursue a solution along those lines, and who knows when you might be able to unseal it. Sorry if this is a silly question, but if we were to reach mass vaccination or almost universal vaccination by the late end of the year, then what would be to fear by allowing international travellers to come back in and potentially seed the virus again if everyone in the country was vaccinated against it?
We're going through a lot of hypotheticals here. The first hypothetical is that you have vaccinated 70-80% of your population then. That 70-80% is enough to confer herd immunity in this virus that we've never yet seen herd immunity for before. Would you then take the risk around Christmas of allowing at that point huge numbers of people? I think you probably wouldn't. I think, let's say we did get to mass vaccination. You can't assume because everyone's vaccinated that necessarily will confer herd immunity. We don't know that yet.
That's the point.
And so what you would do is I think you would let very small amounts of international travel in. I don't think you would say everyone come home for Christmas now. I really don't.
You got to keep in mind as well the new complexity, which is variants. So the UK variant, we now are confident that the vaccines work on it, but we know that it's far more contagious than the strains we dealt with, the Wuhan strain, for example. The jury is still out in terms of the Brazilian variant, the South African variant, as to how exactly they may interact with the vaccines, and will the vaccines be just as effective. What the virologists are telling us is that there will inevitably be other strains popping up around the world as well. And so while we may all, and have no doubt we will achieve the requisite level of vaccination here at some point this year, it doesn't mean that it will necessarily work against other strains. And so that has to be factored into the strategies for the future.
I think Christina was anxious earlier that we'd be hopeful in terms of the messaging, but I have to say this as well, and Gavin, you've provoked it, but the public health are very cautious about the impact of the vaccine on society. Their view is the vaccine, as I said earlier, protects, they know the evidence base protects against mortality and serious illness. They're very slow to say it stops you from transmitting it to somebody else. And so any earlier conversations I've had with people in the public health arena are very, very cautious about all of that. And in fact, the council meeting last Thursday night discussed this issue of would we issue, some tourism-based countries where tourism is a big industry are very eager for a vaccination passport, for example. Whereas the majority of opinion in the WHO are of a view that you can have a vaccination certificate, but only for medical grounds, from the medical perspective. So the jury's out that, but hopefully research will show that not only the vaccines are effective in preventing illness and death, but that the vaccines will also be effective in terms of preventing transmission. That's the hopeful place where we want to land, Christina. And I just think we need to be patient. We've got to keep the focus on the 5th of March. The message really is to people to stay at home. What people are doing right now is working. It is having a significant impact on the downward trajectory of cases, and that ultimately will feed into relieving pressure on our hospitals and our ICUs. That's where we want to be on the 5th of March. And then we can look at other horizons and look at the other hypothetical questions after that. I think we leave it at that, and thank you very much indeed.
Thanks, everyone.